Are you wondering if you might be pregnant? Only way to know for sure is by taking a pregnancy test. But even before you miss a period, you might suspect, or hope, that you're pregnant. Do all women get early symptoms of pregnancy? Every woman is different. So are their experiences of pregnancy. Not every woman has the same symptoms or even the same symptoms from one pregnancy to the next. Also, because the early symptoms of pregnancy often mimic the symptoms you might experience right before and during menstruation, you may not realize you're pregnant. What follows is a description of some of the most common early symptoms of pregnancy. You should know that these symptoms may be caused by other things besides being pregnant. So the fact that you notice some of these symptoms does not necessarily mean you're pregnant. The only way to tell for sure is with a pregnancy test. Classic signs and symptoms of pregnancy. The most common early signs and symptoms of pregnancy might include missed period. The most obvious early symptom of pregnancy, and the one that prompts most women to get a pregnancy test, is a missed period. But not all missed or delayed periods are caused by pregnancy. If you're in your childbearing years and a week or more has passed without the start of an expected menstrual cycle, you might be pregnant. However, this symptom can be misleading if you have an irregular menstrual cycle. There are reasons, besides pregnancy, for missing a period. It might be that you gained or lost too much weight. Hormonal problems, fatigue, or stress are other possibilities. Some women miss their period when they stop taking birth control pills. But if a period is late in pregnancy is a possibility, you may want to get a pregnancy test. Spotting and cramping. After conception, the fertilized egg attaches itself to the wall of the uterus. This can cause one of the earliest signs of pregnancy, spotting and, sometimes, cramping. Light spotting might be one of the first signs of pregnancy. Known as implantation bleeding, it happens when the fertilized egg attaches to the lining of the uterus, about 10 to 14 days after conception. Nausea with or without vomiting. Morning sickness, which can occur at any time of the day or night, often begins 1 to 2 months after you become pregnant. However, some women feel nausea earlier and some never experience it. While the cause of nausea during pregnancy isn't clear, pregnancy hormones likely play a role. Fatigue. Feeling very tired is normal in pregnancy, starting early on. A woman can start feeling unusually fatigued as soon as 1 week after conceiving. Why? It's often related to a high level of a hormone called progesterone, although other things, such as low levels of blood sugar, lower blood pressure, and a boost in blood production, can all contribute. If fatigue is related to pregnancy, it's important to get plenty of rest. Eating foods that are rich in protein and iron can help offset it. Frequent urination. For many women, this starts around the 6th or 8th week after conception. Although this could be caused by a urinary tract infection, diabetes, or using diuretics, if you're pregnant, it's most likely due to hormonal levels. Constipation. During pregnancy, high levels of the hormone progesterone can make you constipated. Progesterone causes food to pass more slowly through your intestines. To ease the problem, drink plenty of water, exercise, and eat plenty of high-fiber foods. Food aversions. When you're pregnant, you might become more sensitive to certain odors and your sense of taste might change. Like most other symptoms of pregnancy, these food preferences can be chalked up to hormonal changes. Nasal congestion. Increasing hormone levels and blood production can cause the mucous membranes in your nose to swell, dry out and bleed easily. This might cause you to have a stuffy or runny nose. Mood swings. These are common, especially during the first trimester. These are also related to changes in hormones. Headaches and back pain. Many pregnant women report frequent mild headaches, and others experience back pain, dizziness and fainting. These may be related to dilating blood vessels, lower blood pressure, and lower blood sugar. Breast changes. Breast changes are another very early sign of pregnancy. A woman's hormone levels rapidly change after conception. Because of the changes, their breasts may become swollen, sore, or tingly a week or two later, or they may feel heavier or fuller or feel tender to the touch. The area around the nipples, called the areola, may also darken. At the end, many of these signs and symptoms aren't unique to pregnancy. Some can indicate that you're getting sick or that your period is about to start. Likewise, you can be pregnant without experiencing many of these symptoms. Still, if you miss a period and notice some of the above signs or symptoms, take a home pregnancy test or see your healthcare provider. The sooner your pregnancy is confirmed, the sooner you can begin prenatal care.